Good afternoon, everybody, and thank you for being here today. Before we start today's normal press conference and briefing, I'm honored to be joined by Colonel Lamar Davis. I recently appointed Colonel Davis, as you know, to be Superintendent of Louisiana State Police. He's joined today by his wife, Krista, and their son, Xavier. We're glad to have y'all, too. Colonel Davis has led an exemplary career in law enforcement. He's earned my respect and that of his colleagues. He's accepted this position in a rather challenging time while the state continues to recover from 3 hurricanes and while we're in the middle of a public health emergency due to the COVID-19 pandemic. Colonel Davis is a native of Baton Rouge. He's been with the state police since 1998. He's been an active duty soldier in the United States Army, and he retired from the Louisiana National Guard. And he has an extensive background in all things military and law enforcement. I am grateful that he and his family have agreed to serve the people of our great state. I do look forward to working with Colonel Davis. And at this point in time, I'm going to ask him to come up and say a few words. If you do have a question or two for Colonel Davis, feel free to ask him while he's here, because I'm going to excuse him once he's finished talking, and then we'll get to the rest of the press briefing.
Thank you, Governor. Good afternoon. Well, I'd like to start by thanking God. Without God, I would not be standing in front of you today. I also want to thank my family, Xavier, Krista. You're my rocks. You're the center of my universe. And also without you, I would not be standing here today. Thank you, Governor Edwards, and First Lady Donna Edwards for the opportunity to lead this great nation and this great agency, actually, and for your trust and confidence. I'm very appreciative of that. I'm committed to earning your trust, the trust of the men and women of the Department of Public Safety and State Police, as well as our citizens. To the incredible men and women of the Department of Public Safety, Louisiana State Police, you may not hear these words often enough, so I'm going to say them now. Thank you. Thank you for the incredible work you do day in and day out. You do a great service for our state, and oftentimes, as I said before, it goes unnoticed. The sacrifices that you make every day serves our great state and is humbling. As we move forward, we will strive to deliver exceptional service and build upon our motto of courtesy, loyalty, and service. The safety and security of every citizen and every community is of personal importance to me. And as such, we will do everything possible. We will do our very best to protect all of our citizens and all of our communities. To our citizens, as we begin a new era with the Department of Public Safety and the Louisiana State Police, I will assure you this. I will lead our agency with integrity, with honor, and with compassion. I will also demand that of our employees, I will encourage and support them in their times of need, but also hold them accountable when their actions conflict with our policies and procedures, the laws of the state, and the Constitution. In closing, please take some time to get to know our troopers and our officers. You'll find that they may actually smile once or twice, but in all seriousness, they're your coaches in your community. They're your neighbors. They're your mentors. And oftentimes, in the worst of times, they're the ones you look to for help. They are here to serve and protect all of our citizens and all of our communities. And I believe that with your help and with your support in the community, we will not just improve as an agency, we will be an agency that the entire state and every citizen in the state can be proud of. To the media, I know that you have many questions regarding some of the recent events. My staff will be coordinating interviews with you so that we can answer your questions. As I transition into my new role, I ask for your continued patience and understanding as I evaluate my agency. Thank you all, and God bless.
Got a couple of questions? I guess they want to get straight to the COVID.
Yes, sir.
Thank you very
Thank you,
much.
Governor.
Thank you, Colonel, and thank you, Kristen Xavier. I'm also joined today by Dr. Cantor. He'll brief you in just a few moments about some of the developments with respect to COVID-19. I do want to talk a little bit about storm recovery that continues. State offices in Cameron Parish reopened yesterday for the first time since late August. And so that means all parishes now have state offices open. And that hasn't been the case in a very long time. The National Guard continues to have 850 guardsmen. So these are soldiers and airmen who are activated in support of emergency operations. And this includes the work that they're doing on 21 testing sites and 8 food banks. All power outages related to Hurricane Zeta have been restored now, which is obviously good news, and the overwhelming majority were restored weekend before last, actually. As of today, there continue to be 2,606 of our fellow Louisianans in shelters because of these hurricanes. 2,399 are evacuees of Hurricane Laura, and they were in 4 hotels, 2 in New Orleans, 1 in Baton Rouge, and 1 in Lafayette. 170 Hurricane Delta evacuees are being housed in a non-congregate shelter in New Orleans, 1 hotel. And then there are 37 Hurricane Zeta evacuees in 1 non-congregate hotel shelter in Terrebonne Parish. DSNAP has been approved for 5 additional parishes because of Hurricane Delta. Those parishes are Beauregard, Lafayette, Rapides, St. Landry, and St. Martin. To apply for DSNAP, impacted residents in these parishes must call DCFS Monday through Friday of next week. Now that's going to be November the 16th through the 20th. You call 1-888-524-3578. It's a toll-free number, 1-888-524-3578. Call next week from 7:30 a.m. to 6:30 p.m. If you pre-registered for DSNAP online, you still must call and apply. And to apply, you have to interview by phone. So this is the only way to determine whether you're in fact eligible. Now, if you're a resident of Beauregard, Rapides, and St. Landry, and you previously received DSNAP due to Hurricane Laura, you will automatically receive the DSNAP benefit for Hurricane Delta. So you don't have to reapply. To find more information, you can go to the DCFS website at dcfs.la.gov. Now, moving to COVID, we are reporting the largest number of cases today that we've reported thus far. And it's 3,492 cases. Now, 2,812 are the PCR test positives, and then 680 are antigen test positives. I just want everybody to let that sink in for just a moment about these cases that we're reporting today. Dr. Cantor is going to speak to you in a few minutes, and he's going to get more into the details around the PCR testing and the antigen testing. Now, we don't really have a backlog to talk about as influencing that number and making it so high. New cases are rising sharply across the state of Louisiana and in all regions of our state. The number that I just gave you are the positive results from 37,432 new tests being reported. Very sadly, today we're also reporting 24 new deaths, and the total deaths now 6,121. Again, that number is going to be put into context for you very shortly. There are 692 patients in the hospital with COVID-19 across the state of Louisiana. That's up 16 from yesterday. It is also the highest number since September the 11th. So we have quite literally lost a couple of months' worth of improvements in terms of hospitalizations are concerned. 62 of those individuals are on mechanical ventilators, and that's up by 3 since yesterday. Statewide positivity continues to inch up. On November 1st, it was 4.6%. On November the 8th, 5.2%. And again, we know that it's increasing across the state and in just about every region. And this doesn't just happen. It happens for a reason. 2 weeks ago tomorrow, I guess it was, Halloween, and I received an awful lot of reports that in communities all across Louisiana, it was noticeably obvious, I should say, that individuals were not adhering to the mitigation measures to the degree that they had before. And so we're starting to see these numbers now as a result of that, as we have in the past, when we've had a lot of folks across the state who stopped adhering to the mitigation measures and wearing their masks and so forth. Also, it's been a couple of weeks since some members of the House of Representatives signed the petition that they signed and caused confusion as to whether the mitigation measures remained in place, and that was obviously unfortunate. The good news is that petition has now been ruled unconstitutional, so it should be obvious to everybody the proclamation of a public health emergency remains in effect. We remain in phase 3 with the mitigation measures contained therein and the restrictions that are contained therein. But there's no doubt, because I've received reports, that petition in and of itself led to diminished adherence to the mitigation measures because of confusion and so forth. And these mitigation measures were advocated for by the White House Coronavirus Task Force, and obviously were contained in the proclamation at issue. I think it's also fair to say that we have seen an increase in the private social gatherings, not just in Louisiana, but around the country. And these are driving cases all over the country. These are things like game nights, dinner parties, weddings, and baby showers. Not only that, but we have sister states that are now bringing back online field hospitals. And that's multiple states around the country doing that, including a sister state in Texas. Also bringing in refrigerated trailers to provide additional morgue space for bodies. And this continues across the country as the number of COVID cases surge. And whether you call this the second wave or the third surge, I don't think it really matters. Now, is Louisiana in this shape today? No, we're not. But we're on a trajectory to get there, and the only way that we get off that trajectory is for the people of our state to once again become determined and resolute and adhere to mitigation measures in much greater numbers, because that is going to be our reality if we don't. And so we have to start doing, again, in far greater numbers those things that we know work to slow the spread of the virus. Wearing a mask, social distancing from folks 6 feet when you're not from the same household, washing your hands frequently, staying home when you're sick. And I do want to stress that we can turn this around. I know we can. We got to start now, though, because you're always further behind than you think you are. That's the nature of a pandemic. You're always further behind than you think that you are. And if all the behavior by everybody in the state improved today with respect to the mitigation measures, we're at least 2 weeks before that shows up in the data. In the meantime, the cases continue to grow, the hospitalizations continue to grow, and unfortunately, we know the deaths come behind the hospitalizations. We do not have to go backwards in terms of reimposing restrictions that we've already moved through. So we don't have to go to phase 2. We don't have to go to phase 1. But the people of Louisiana will determine whether, in fact, we have to do that. And so I'm imploring everyone, again, to get serious about COVID-19. And just look at what's happening across the northern hemisphere and around the country. And we know that there is no reason to believe that that won't happen here in Louisiana. In fact, there's every reason to believe that it's already starting to happen here. The good news is that there are therapeutic treatments. We believe that there will be one or more vaccines that will be available perhaps as soon as by the end of next month. But we cannot kid ourselves. It's going to take many months before vaccines are produced and distributed and administered to make a difference. In the meantime, we have to continue with the mitigation measures that we know work. And I know that we're all tired. I get it. COVID fatigue is real. But just because we're tired of COVID doesn't mean COVID's going to leave us alone. That's not the way it works. And so we need people to step up now, be leaders, whether you're in the business community, whether you're in the faith community, whether you're an elected official or whatever. We need everybody stepping forward and saying, you know, we have to do this. I don't know if you had an opportunity to see Secretary Azar, the Secretary of Health and Human Services, last night, giving very long interviews, imploring people to do the exact same thing that I'm talking about here today. And the way we enjoy as much normalcy as possible between now and whenever we finally put COVID-19 in the rearview mirror is by doing these things. Because we can have our businesses open and our economy open. But we have to wear the mask. We have to do things from 6 feet apart from others. Wash our hands and, again, stay home when we're sick. In order for the mask to be effective, you've got to wear it over your nose and mouth, I should say. Obviously, wearing it below your nose or under your chin it's just not going to be helpful. So please wear it and wear it correctly. And the CDC put out information this week that recent studies show wearing the mask doesn't just protect those around you. It actually protects the wearer too. And of course, we should do it just in order to be good neighbors. But there's this added benefit that if you wear the mask, it is filtering and blocking out particles that contain the virus. And so it actually affords protection to the person who's wearing the mask as well. And in the grand scheme of things, given how contagious this virus is, and how deadly this disease is, it's not asking too much. It just isn't asking too much. So at this time, I'm going to ask Dr. Cantor to come up and to talk more about what we are seeing. You can feel free at the end of his presentation to ask him questions as well. And then I'll come back up on the backside of that and complete my prepared remarks and take a few questions.
Good afternoon, everyone. Thank you, Governor. Thank you for your leadership. What I'll try and do is speak a little bit about a couple improvements that have been added to the dashboard recently, and then I'll transition and talk more broadly about what we see going on across the state in terms of COVID. So as of today's dashboard update at noon, we added a couple improvements that I'll run folks by, and I'll try to do my best to preemptively answer any questions that there might be. The first is that we've standardized the way that we report out percent positivity. So across the dashboard now, you'll see it exclusively reported out as a cumulative week on week on week, and that carries out throughout the dashboard. The second improvement that was made is the incorporation of antigen or probable cases and antigen tests that have been conducted and reported throughout the state. So both in Louisiana and across the country, there's been more and more point-of-care antigen tests being used in COVID. It's a relatively new testing platform. It has some pros, it has some cons. The pros is that it's typically less expensive than what we consider the formal or gold standard test, which is a PCR. It's quicker. Typically, it takes 15 or 20 minutes to do. And in most cases, it can be done at the bedside or point of care or right next to a patient. It doesn't need to be sent off to a lab. Those are all the pros. The cons are that in most cases, it's not as sensitive, it's not as accurate as a formal test. And for some types of individuals, particularly if you don't have symptoms at the time that you're testing, it might not show positive when you might in fact be positive. So risk benefit on these types of tests, but they're becoming more available. They're being used in increasing numbers throughout the state. And it's really important to be able to know how many tests are out there so that we have visibility on all the data. That's what drove the inclusion of antigen tests today. So if you log on to the dashboard now, across the key measures, across total positive cases, total deaths, and total tests run, you'll see those numbers broken out, subdivided into confirmatory or PCR and probable or antigen. We've done our best throughout the dashboard to be really clear when we're talking about a total number and giving you the breakdown. So if you go farther into the dashboard, you'll see a graph that shows the number of positive tests coming in every day according to collection date, because that's more accurate. And if you'll see on the bar graph, it'll show you how many of those for any day in the past history are PCR tests and how many are antigen. We have antigen tests going back to about the middle of May, but they've been used in really increasing numbers going forward. I think they're going to continue to increase in usage throughout the state because they're so quick and so easy. So I know there's a lot of questions on there. I'm going to do my best to kind of answer some of the questions that we've been asked today, and then after I'm done, I'll be happy to answer any other questions on this new inclusion into the dashboard. So how reliable overall are the antigen tests? It varies a little bit based on the type of antigen tests you're doing. They're not all exactly the same, although all of them are the most accurate when the individual being tested has symptoms. So the best use case for antigen tests are in symptomatic individuals. When they do fail, so to say, it's usually that they don't detect virus when it really is there. If an antigen test is positive, particularly if the individual is symptomatic, it really, in all likelihood, means that that's an actual case of COVID. How long have we been using the antigen tests, and why incorporate them now? We've been using them really since May, but in small numbers back then, in increasing numbers now. And the reason why they're being incorporated now is because they're going to continue to be used in increasing numbers. And we need to make sure, particularly as we see cases going up across the board, we need to make sure that we have good visibility across the board. We want as much signal coming in on what this outbreak is doing, and increasingly, the antigen tests are becoming an important part of that. If I have a positive antigen test, do I need a PCR test? The answer is that it varies, and you really do need to talk to your medical provider about that. For the vast majority of people who have symptoms concerning of COVID, they're symptomatic, and then they receive a positive antigen test, they have COVID, and they don't need a confirmatory test. For people that don't have symptoms and have a positive antigen test, they oftentimes will need a confirmatory test, but The larger point is for anyone that receives a positive antigen test, in all likelihood, they have COVID, and they need to be acting as if it was a positive PCR test, without question about that. Anyone that has a positive antigen test needs to do every single thing they would do otherwise. They effectively have COVID, which means going home and isolating and making sure that their close contacts are notified and cooperating with the contact tracers, and all of those things that we do for people that do have COVID. What should I do if I get a positive antigen test result? First thing you should do is act like you have COVID, because you almost certainly do. Isolate yourself and discuss it with your medical provider. This is a popular question. I'm happy to answer it now. Can I use an antigen test to get out of quarantine? No, unfortunately not. We get this question a lot, and everybody wants, so if someone's in quarantine, they're in quarantine because they had a close contact to a positive case, and they typically need to quarantine for a period of 14 days from that last exposure. A lot of people want to be able to get tested in the middle of that 14-day period, hopefully have that test be negative, and then be done with quarantine. Unfortunately, it doesn't work that way, and we see people that become positive later in that 14-day period. So just because I tested negative today and I'm day 6 of my quarantine period, I could easily still become positive tomorrow on day 7 and be infectious and be a risk to those around me. So if you're quarantining for 14 days because of a contact to a known case of COVID, it's a good idea to get tested. Even if you have a negative test, you still have to quarantine the remainder of those 14 days. And does the antigen test change on the dashboard affect the metrics like bar reopening or nursing home visitation or high school football games? And the answer is it does not, because we've incorporated the antigen test into every part of the dashboard with the exception of percent positivity. So the antigen tests are not being included in percent positivity calculations at all. That's largely because that's the guidance that the CDC provides. So it really has no effect right now on parishes looking at bars reopening and those types of things. Now, I'll be happy to answer other questions on the antigens afterwards. I do want to caution about getting bogged down in these type of descriptors when the thing that it is we are describing has not changed and is actually worsening. You can measure wind speed by miles per hour or kilometers, but it's blowing pretty hard and it's picking up. And that's where we come to right now. Across the board, every region of the state, we are seeing the number of new cases day on day increase. We're seeing increases of COVID every region of the state right now. We're seeing increases in the number of hospitalized patients with COVID, and we're seeing increases in the number of people presenting to emergency departments with symptoms concerning of COVID. We're seeing increases across the board. As the governor mentioned, we're not yet at the place that some other states are, but that certainly doesn't mean we won't get there. And if we don't double down our efforts, I think we might. And we've been really good at the mitigation measures, masking and distancing, and I think that's why we've not seen increases like other states have until now. And that's why I think we won't reach the levels that other states have, but we could still see very concerning increases if we don't double down on those efforts. No mitigation measure is 100%. They're not preventative. They're mitigating and risk reduction measure, and that's important to keep in mind. To be very clear, every measure that we're looking at right now, and it's pretty clear if you scroll through the dashboard, is showing increases. Every region across the state and statewide. We, as a state, have a window of opportunity right now. You look across the country, you see what's happening. It's beginning to start here. We have a window of opportunity. That window is closing as we speak. We have to be more vigilant than we ever have right now, particularly going into the holiday season and Thanksgiving. I wanted to share one epidemiologic story, so to say, that really impacted me when I read it last week. And it's a report from the CDC about an outbreak that they tracked in Maine that was based on a small wedding of 55 people. And I think these type of events, these spreader events, happen a lot. It's a little bit more rare that you actually get such good data, such granular data to trace it. You oftentimes don't get that. We got that in here, and I think it's worth sharing. So this was a wedding back in August in rural Maine, a wedding attended by 55 people. There was some transmission at that wedding. There were individuals who were positive and asymptomatic, didn't know it at that wedding, and spread COVID in that wedding. None of those 55 individuals got very sick, but they all went home to their communities. In the local community of where that wedding was, they tracked 27 cases and 1 death in individuals who weren't even at the wedding. They just came in contact with people that got infected at the wedding. At a nursing home 100 miles away from the wedding, they tracked 38 cases and 6 deaths amongst individuals who weren't even at the wedding. They came in contact with somebody who was at the wedding. And at a jail 200 miles away, they had 82 cases of people who weren't even at the wedding. The reason I say this is everything we do in COVID affects somebody else, whether you realize it or not. And as we look forward to Thanksgiving, I need people to really be thinking about what's important. How do you protect the ones you love? How do you set them up to be safe and those around you in the community? And the scary thing about COVID is that I could be positive and infectious right now, and I have no idea because of the asymptomatic infection. And as I illustrated, it can snowball quite dramatically. So please be careful going into the holidays. And remember, we really do have a window of opportunity now, but the time's running out on that window. Be happy to answer any questions if there are any. Yes, sir.
Talk a little bit about hospital capacity and what that looks like in various regions, especially in the context of flu season. I know the baseline for like ICU beds typically is higher right now.
As the governor mentioned, we're seeing increases in hospitalization. We're not yet threatening capacity, certainly not the way that we were during the first spike in March and April or the second spike in July and August. We are getting close. And if you talk to certain hospitals, they're getting very close on their ICU capacity, but we're not yet truly threatening it the way that we were. Thankfully, our flu cases have been historically low, both low as an absolute number and also lower than national average. Flu season formally started October 1st, so we have some good data now. And I'll tell you, most years we are leading the country in flu. This time last year, we were talking about how we really needed to do a better job with flu. We're actually below national average right now. I really think it's because of all the good things we're doing with COVID mitigating. Flu is a respiratory virus just like COVID is, and wearing a mask and distancing and hand washing help prevent the transmission of both. So we're not seeing the big cases of flu that we kind of feared. We were worried earlier that we would have crowded hospitals because of flu like we do most years, and then have the added burden of COVID patients on top of that. Flu's not been a big challenge right now because of all the mitigating measures. We hope that continues. And hospitals still do have some capacity, but one of the concerning things, and when you look at other states, look at Dakotas, Utah, these cases snowball. Oftentimes the increase is not linear, it's exponential because one person infects 2, infects 4, infects 8. So you can get in a tough situation with hospital capacity very, very quickly. So long story short, we keep a very close watch on that. We're not at capacity yet, but we still need to be as vigilant as ever with mitigating and prevention. Yes, sir.
To follow up on that, are you seeing significant differences in different regions of the state in terms of the major factors that you look at? If so, what are some of the factors that might be playing?
I'll say as the days go on, we're seeing concerning increases across the state. We certainly, really a couple of weeks ago, were really concerned about the Shreveport area, about central Louisiana. Before that, we were really concerned about the Lake Charles area. But I think if you look at the dashboard right now, you'll see increases in every region of the state. So it would be false to say the problem is really isolated to one part of the state. This is, I think, truly affecting the state right now. Thank you.
Thank you, Dr. Kenner. And it is tied in with the questions you just got. Going to continue to urge people to get a flu shot. It is very important this year, and it is not too late. So get a flu shot, even if you're an individual who doesn't normally get them. Please get them this year. We don't want to have a serious flu season while we are also fighting the pandemic. And it is a good thing that the mitigation measures that work to reduce the transmission of COVID also work to reduce the transmission of the flu. But we're waiting on that COVID vaccine. The flu shot is out there. So asking people to do that. And while we are reporting antigen tests for the first time today, I do want to just go back and hit the numbers. We reported 3,492 new cases today. 680 were antigen tests. 2,812 were PCR tests. 2,812. So had we not talked about at all about antigen, the number today would have been 2,812. So I don't want anybody to be confused out there that because we added antigen to the dashboard and to the numbers, that somehow that inflated what we would be talking about. This is a very serious increase in cases. We've also talked about hospitalizations increasing markedly over the last couple of weeks. And I can put those in perspective for you. In the first surge, March and April, hospitalizations across the state, although the outbreak really wasn't evenly distributed across the state. As you remember, it was really pronounced in places like New Orleans and Jefferson Parish and Shreveport and Monroe, but more than 1,900 were in the hospital. It was right at 1,600 at the peak after the second surge, and now we're right at 700, having given up the last couple of months of gains. And again, I want to caution people that we are literally powerless to do anything about the numbers for the next 2 weeks. If people started today in much greater numbers adhering to the mitigation measures, that's when we would see the results, is in a couple of weeks. That's why it's really important what Dr. Kenner said. We have to start now. You can't keep waiting. We don't want to be like El Paso, Texas. We don't want to be like Massachusetts and Wisconsin and North Dakota and South Dakota and so many other places. And we've been in situations before where we were surging, and we know these measures work. So this isn't hypothetical. Nobody's guessing here. These measures really work. So we're encouraging people to comply. I do want to also echo what Dr. Cantor said. Now families are planning their Thanksgivings and their Christmases. Please make sure that you are cognizant of all of these challenges and plan something that's going to be safe for your family. And we know that typically around Christmas and Thanksgiving, we bring in multiple generations of the same family together in close proximity. And just about at every table, you're going to have individuals, if we do that this year, who are going to be vulnerable to the disease. And so we need to be very, very careful and look at your risk levels and think about how you're going to do things differently, even create a new tradition or a new way of celebrating this year. There are some things to consider. Low risk activities include having dinner with everyday household members, shopping online, hosting a virtual dinner with family and friends. Medium risk activities include attending small outdoor gatherings with family and friends. Small, where you stay separated and so forth, but that's a medium risk. High risk activities include attending large indoor gatherings with people who are not from our immediate household, going to crowded stores, or anywhere where people are not abiding by the mitigation measures of wearing masks and distancing. Potluck style dinners, those are the sorts of things really driving a lot of infections right now. So the virus is opportunistic. Doesn't care whether we're watching football together, doesn't care whether you're a Republican or a Democrat or an independent, young or old, whether you're related to the person that you're talking to or your neighbors or whatever, just doesn't care. And I know that we all have things that we typically do around the holidays, probably more so in Louisiana than elsewhere, but this is just not a typical year. So asking people to please be cognizant of that. Get creative in how you celebrate. Over the coming week, I really encourage you to talk to your family, come up with a plan that is safe and sensible under the circumstances. And so at this time, I'm going to take a few questions. Sam?
Governor, you mentioned that most of the transmission right now is driven by these, backyard gatherings or whatever. Does that sort of dull the effectiveness of, this tool that you have with new restrictions on businesses, if that's not really what's driving a lot of the case growth? Is that just sort of the last?
No, it's not an either or. I mean, we continue to contact trace cases back to businesses as well. But we're working with information that we're getting both here in the state and from the White House Coronavirus Task Force. And we know that a lot of people will be very conscientious when they go to a commercial establishment, whether it's to eat or to get groceries or whatever. But when they get home and they're in their backyard and they have a gathering with their neighbor or their friends or their relatives, they're much less likely, unfortunately, to distance and to stay outdoors and to wear masks and all those sorts of things. So these cases are being generated. But the restrictions remain a very important way to reduce transmission. The mitigation measures remain an important way. It's just that as we see additional data that really seems to be driving a lot of the cases, certainly not all of them, we feel obligated to bring them to people's attention. Yes, sir.
Hey, Governor, do you have a certain percent positivity rate for the state or a certain number of cases where you feel like the state should move back in line?
Yeah. No, I don't. What we're going to work very hard to do is make sure we never lose the capacity in our hospitals that we need to render life-saving care. And so that really is the measuring stick. And knowing that you're always worse off than you think you are, anytime the numbers are surging, and knowing how long it takes to have a course correction. Assuming that people's behavior does change for the better, then you have to look at all of those things and talk to the folks at the Department of Health, but also the hospital CEOs and medical directors from around the state as to what they're seeing. And we really don't want to get there. And the good news is, as I stand before you today, I am confident that if we will engage in these mitigation measures in a way that is much more robust, where many more people than currently is the case are wearing their mask and washing their hands and physically distancing, staying home when they're sick. If that will happen, we won't have to go back to phase 2 or to phase 1. We won't have to reimpose restrictions that we've already lifted. But I think we owe it to one another as Louisianans to make sure that we can render life-saving care in our hospitals. And this is a nationwide surge. We should not kid ourselves into believing that we can greatly increase our capacity outside of our current hospital footprint because the staffing is just not going to be available. There are only so many doctors and nurses and respiratory therapists and so forth in the country. And they're all needed where they're living and working presently. And so what may have been available to us back in April and May of this year, we shouldn't assume that it's going to be available to us now, which is why we're making this fervent appeal to the people of Louisiana. And by the way, the people of Louisiana in the past 2 instances have responded well. And I'm hopeful, I'm optimistic. I believe we will do that again. But whether we actually have to go backwards will be in the hands of the people of Louisiana. And I pray that we don't, because that means more people have gotten sick, more people have gone to the hospital, and it certainly means more people are going to die. Yes, sir.
Essentially, their bars are closing, and I've been speaking with bar owners who feel, and this is a discussion we've had before, that they're being targeted. when a parish hits 10% positivity for 2 weeks in a row, why not make it a unilateral reduction in capacity of bars, restaurants, other areas, instead of just targeting?
Well, because we have not found the level of transmission at restaurants that we find at bars. It's really is just that simple. That venue, for reasons that we've discussed here, nobody is targeting bars to punish bars, but the nature of the business and what people go to bars to do, to socialize and to stay there for long periods of time, to drink, which means they're not going to have their masks on while they're drinking. Typically there's loud noise, and so you have to get closer together so that you can hear and be heard. All of that is conducive to spreading the virus. That is not the case at restaurants, and I'm not saying that there's no transmission taking place at restaurants, but the degree of transmission is not nearly as pronounced where people go with a small party. They're there for a certain amount of time when they eat and they leave, and when they're eating, they're not visiting everybody else in the establishment. And so what we tried to do was come up with a reasonable and reasonably safe way to allow bars to reopen where you had relatively low community spread, meaning that even in those environments that they could reopen and do so safely by requiring a limited occupancy of 25%, by requiring the patrons to remain seated, for example, and having limited hours by closing at 11 o'clock. But when you have community transmission that is elevated as evidenced by high positivity, meaning in addition to 10%, it just isn't safe to have those venues open. And I will tell you that that is even more generous than the White House Coronavirus Task Force recommended with respect to bars. They believed it should have been 3% positivity. And above 3% that they shouldn't be open. So we're trying to do what we reasonably can. And I understand that some people are unhappy about it. We're not targeting anybody. We're not trying to be punitive. We're trying to preserve and protect public health and keep people from dying. And I do hope and pray that whether it's Ascension Parish or some other parish, they can quickly get back on top of things, get that percent positivity going down, and then we can get them below 5% and get them back open in a way that's safe. Anything else? Oh, I'm sorry.
Are you satisfied with the level of cooperation you're getting from local officials in Lafayette?
Well, look, I guess I would appreciate it, and I mentioned this earlier, especially with what we're seeing around the country, what we're now seeing and is indisputable here in Louisiana, that we get more buy-in from leaders across the spectrum, whether they're faith leaders, whether they're leaders in nonprofit agencies or in the business community, and certainly elected officials. Because what I hear from them quite often is, well, we really don't want to go backwards. We got to phase 3. We've got more businesses open, and they're opening to a greater degree today than was the case previously. We don't want to go backwards. Well, the way to keep from going backwards is to engage in the mitigation measures that we know work, that have proven effective here in Louisiana and elsewhere, those things that the White House Task Force has asked us to do. And so I think you mentioned Lafayette, so whether it's the mayor president of Lafayette or anybody else, I'm encouraging them to help and to do these things. It really is critically important, and because we don't want to go backwards on the restrictions. We know that it's tough enough for people right now in terms of the economy and their businesses and their livelihoods. But we also know we don't want to go backwards and have this surge get out of control where it's not livelihoods that we're talking about, but it's lives and greater numbers that people who are dying from this disease. And we're trying to manage that and strike the right balance. And that's what's, we've been trying to do from the very beginning. And reasonable people can disagree about exactly where to strike that balance, by the way. But those people who believe we should have nothing open, are not reasonable, and those people who believe everything should be open without restriction and without any mitigation measures, they too are unreasonable. And we're going to try to be guided by the science and the data, the recommendations coming from professionals. That's what we're going to do in Louisiana. And I will continue to do my dead level best to be as transparent as possible, show you the data that we're making our decisions on, show you where the recommendations are coming from, and so forth, because I am determined that we are not going to have people die in Louisiana because we don't have a suitable hospital bed and medical staff to take care of them. And that is possible if we don't get on top of this. So I encourage people to do as much as you can. Remember, we've asked you all along to be a good neighbor. We try to remind everybody you have a role to play. Well, that's as true in November as it was in July and as it was in May and April. And in fact, now we ought to, I think, get better buy-in because we know, beyond a shadow of a doubt, that these things work. We've seen them work here and elsewhere. But it's time to make sure that we're all engaged in these common sense, proven mitigation measures. So I'm going to ask you one more time. Please wear your mask. Social distance when you're with people who are not part of your immediate household. Wash your hands frequently with soap and water. Stay home when you're sick. Get your flu shot and protect the vulnerable. If we will do these things, we're going to be just fine. But if we don't, we're going to continue to see our numbers grow the way that we've seen them grow here over the last number of days. And that will be tragic. So thank you all very much. We anticipate having another press briefing with you next week. Thursday. Okay, so we'll be looking at Thursday of next week. Thank you all and God bless.